How did Bismarck and Beveridge healthcare models evolve in Europe? Imagine a time when countries were figuring out how to give their citizens healthcare that was fair, affordable, and reliable. That's where the story of to big healthcare ideas begins. The Bismarck model started in Germany in 1883, created by Chancellor Otto von Bismarck. It was designed to help workers and their families get health care through mandatory contributions from both employees and employers. These contributions funded sick funds, which paid doctors and hospitals for services. Bismarck wanted to improve worker health to boost the economy and strengthen the nation. Over time, the system grew to include accident insurance and pensions, becoming more comprehensive. It became a system where many insurers competed, but everyone paid into it based on their income or job. Countries like France, Belgium, and the Netherlands adopted similar ideas, keeping the core principle of employment-based insurance. Meanwhile, the Beveridge model was born in the United Kingdom in 1948, created by William Beveridge. It is based on the idea that health care is a right for everyone, funded through taxes. Instead of multiple insurers, the government owns and runs most hospitals and clinics, providing free care at the point of use. This system aims for equal access, no matter your job or income. It relies on centralized funding, which means the government handles most of the costs and services. Countries like the United Kingdom, Spain, and Italy follow this approach, making health care accessible to all citizens without direct charges. For Americans thinking about living or retiring in Europe, understanding these models is helpful. If you move to a country with a Bismarck system, you will likely need to register with a statutory health insurance fund. Your contributions will depend on your income or employment, and you can usually choose from private and public providers. Countries with the Beveridge system will fund health care through taxes, so you won't pay directly when you visit the doctor. Instead, you'll access services through government-run facilities, often with little or no cost at the point of care. In practical terms, if you settle in Germany, France, or Belgium, you will probably join a health insurance fund and pay a percentage of your income. Your coverage will be broad, including visits to doctors, hospitals, and sometimes even dental or vision care. If you choose to live in the United Kingdom, Spain, or Italy, your health care will be mostly tax-funded. You will visit public clinics or hospitals, and most services will be free or have minimal charges. Both systems have changed over time to improve coverage and quality. The Bismarck model has added more benefits and options for private insurance, while the Beveridge model has worked to reduce waiting times and expand services. For Americans, knowing how these models work helps you understand what to expect when living in different European countries. It also shows how history shaped the way healthcare is delivered today. Whether you prefer a system based on employment and insurance, or one based on taxes and public services, Europe offers a variety of ways to access healthcare that suit different lifestyles and needs.